Can everybody see that okay?
Yep.
Yep.
I shall start with a slideshow. Sorry, everybody, just there we go. Trying to get the right button. Is that okay, everybody? You can see that? Grand. Okay, so I suppose some of you might be thinking, why are we having a national care strategy in the middle of a pandemic? Why now? But I think it's important to note that this isn't just a national care strategy, it also incorporates a lot of COVID-19 recovery. So it's really a dual plan. And you'll probably know that carers have been calling for COVID recovery plans specifically for carers for quite a number of months. There is a COVID recovery strategy, which the Scottish Government produced, but it was a bit disappointing in terms of what it included for carers. So I think it's really a very good move that they are looking at COVID recovery and a national care strategy for carers. And obviously, when we start looking at COVID recovery, and the things that are needed to support carers at the moment while the pandemic is still going, but also hopefully as we move out of it. Some of the things that we would talk about are things that can't happen in the short term, which is why I think it's also good that they are talking about a care strategy as well, so they can look at both the short term, immediate things that need to be done, but also moving into some things that might take a little bit longer. So this first slide I've put up, these are messages I've got direct from the Scottish Government in terms of what it's about. So the Minister for Mental Health and Wellbeing, he has committed to this standalone strategy. And as I said, it's dual purpose. They're looking for both short-term and longer-term support in a meaningful and sustainable way. And the strategy will focus on carers and their needs. It's also looking at policies across the Scottish Government. Because as you'll hear later in the day as well, there's the development of the National Care Service. You'll probably know already that they're looking at the carers benefit. Carers allowance is being brought over to Scotland and also reviewed in time. So there's that, there's mental health legislation, there's all sorts of things that will be very relevant to carers. So this will be a cross-cutting strategy as well, looking at different areas. And the Minister is also committed to engaging with unpaid carers about the strategy. What I would say about that is, you'll know we have been talking to carers for many years. Some carers are feeling that there's been a lot of consultation lately. So it's not just about new conversations. Those are important, like the conversation we'll have today, but it's also about all the conversations that have gone before and making sure what carers have been saying during the pandemic and even before are built in as well. So that's just the kind of overview. In terms of timescales, it's actually a very short timescale, and they've committed to developing it by late spring. This is Scottish Government speak, they always use the season, so late spring might be heading towards sort of September, October, who knows, but they're certainly planning to have it within this year, and certainly aiming to have it towards the summer, I would imagine. The kind of group heading it up is Carers' Rights and Support Steering Group. So they're the group where it sits with, but as I said, they are talking to many other stakeholders. And what I'm going to move on to talk to you about is the national care organisations have been working on a set of briefing papers, which they're not quite finished yet, they're in draft form, but we have shared the drafts with the Scottish Government, and with the idea of taking different areas which are important to carers and looking at some of the evidence around the need and then some of the measures that might support carers in order to make sure that all the work that's gone before is included in the development of this carer strategy. So, like I say, we've already kind of pulled together some information that carers have given us already, and some of the areas that we've looked at in developing these are the Carers Manifesto commitments, which we did a lot of work on before the election, responses to the national care organisations when we did our consultation on the National Care Service. And that took in a lot of responses from carers. From the polling, for example, we did, there was over 1,000 for one of the polls and about 600 for another. So a lot of carers were involved in that, and a lot of it's very relevant. a lot of the evidence and research over the pandemic. So a lot of surveys were done, particularly by Carers Scotland and Carers Trust, looking into the impact of the pandemic on carers. And I'm going to go on after this to talk to two of the carers on the pandemic response group, the Scottish Government Pandemic Response Group, and they did a lot of work on that, and they'll be telling you about that. So, you know, what I'm saying is this has kind of been developed building on evidence that we have already. And so I suppose what we're doing today a bit is testing out some of the ideas that we have on measures that might support carers. So we're not starting from a blank page. So I'm just going to talk through a few of the areas, and these are also the areas that we'll go talk about in our discussion groups, and specifically looking at the measures that could support carers, both phase 1, which is, you know, COVID recovery and during the pandemic, and then phase 2, slightly longer term. So the first one is breaks from caring and social care. And you'll not be surprised at any of these measures because I know you've been talking about them for a while. So the first one obviously is reopening services. They are opening slowly in some areas, but certainly not right across the piece. And an important thing that carers have been talking about is if there are future variants and there are kind of measures that need to be taken in terms of social care again in the future, contingency plans to make sure carers aren't without support as they have been during periods of the current pandemic. A big thing would be ring fencing Carers Act funding for direct care support, because that is quite a substantial resource that the government has provided for carers, but we know it doesn't all go direct to carer support. So ring fencing it, making sure it goes to the right place will certainly be very helpful. And a lot of you may know about the COVID-19 SDS guidance, which has been recently relaunched and reviewed. And in a nutshell, what that does is it ensures that if you have a direct payment or possibly other forms of SDS as it's moving towards, you can use it more flexibly. So making sure that's permanent and ensuring it's consistently applied across Scotland. And then the last one is about people who are maybe new to caring or whose caring roles have increased, and rather than having to go from scratch through assessment, topping up existing SDS packages. So those are some of the measures that could happen in the short term to support carers in relation to breaks from caring. In terms of longer term, we know that a lot of this is to do with the workforce. It's not just the fact that we've had the pandemic and some services have had to stop or reduce. We know that it's very difficult in terms of recruiting people into the social care workforce. So that is a big piece of work. And without that, I think it'd be very difficult to extend different forms of support to carers. And increasing capacity for short break services in general. You'll know that the government is talking about a right to breaks from caring as part of the National Care Service. And, you know, that won't happen overnight. So the preparations for that can begin now and be more medium term and longer term. And finally, local areas should be looking to see what breaks they have in their areas at the moment to look for those gaps and decide where those need to be filled. So those are just a few of the measures in relation to short breaks and social care. Like I say, the papers are fuller that we've developed and they go into a bit more detail, but this is just highlighting some of them, which will hopefully help discussions when we go into our discussion groups. So the next one, mental health and well-being, we kept that one as a specific paper because it's so important given the impact that the pandemic has had on a lot of people's mental health and well-being. So in terms of short term, providing carers with access to tailored mental health support the same as the workforce. Like I say, work has been done in terms of supporting the social care workforce and their mental health and well-being, and the same needs to happen with carers. For example, if they were able to fund counselling services through carer centres, that would be a really good measure. And additional bereavement support for carers is another one, because we know as well as people who have lost people during this period, carers having to adjust in terms of their new role is also something which can mean that they're going through a bereavement process. Ensuring carers have an emergency plan in place, because that can certainly help in terms of people's anxiety and sense of well-being, knowing that there's a plan in place in case of an emergency. And then more longer term, tying it into the upcoming mental health strategy, ensuring that there are measures there for carers and that they can access mental health support. And again, promoting emergency planning more widely. And I'm hoping as we go into groups that you'll have more of the ideas yourself of what you think of this and what other measures we could add. In terms of hospital and healthcare, there's been so much talk, obviously, about this during the last few years, and there has been many measures to support carers, which has been very helpful. So things like priority for boosters and flu vaccinations, making sure that they continue, ensuring appointments are accessible. It has been difficult for some carers to make it to their appointments, particularly if they don't have replacement care or they're in a difficult place in terms of travelling. So improving that. Providing guidance in hospital visiting to make sure carers are viewed as essential visitors and partners in care whenever somebody leaves hospital. And then there's also, I think, particularly now as the rules are changing and throughout the pandemic, it's always been important to give people information, but I think specifically now, targeted information for people who are higher risk is almost more important than ever. Continue to prioritise carers for PPE and testing. The PPE hubs, which provide carers with free PPE, have been extended until September. In terms of testing, we know that Westminster is looking at testing and that's ending, but in terms of Scotland, we hope that it will continue to be a priority and free for carers. So that's certainly what we'll be advocating for. And ensuring carers have access to replacement care so they can get to their own health appointments. Unfortunately, carers' own health in terms of attending even the dentists or the GP or hospital appointments, people haven't been doing that because they've been finding it very difficult to leave without replacement care. So that is really essential. And unfortunately, there is impact from that. So in terms of longer term, in terms of hospital and healthcare, social prescribing is one thing we'd like to see increased, including things like a discount card and free access to leisure, because obviously that will help carers' health long term. And providing more flexible GP appointments, longer appointments, home visits where required, etc., and times which suit carers. And that is something, again, the Scottish Government's looking at the moment. Finances and employment. In terms of shorter term, there has been funding gone out, you'll hopefully know, through local carer centres, but that money was certainly limited. So in terms of, for some of the carers who may not have been able to access that, we would be advocating for ring fencing part of the Scottish Welfare Fund for carers to continue to support carers where they find themselves in hardship. Extending home working for some carers, you know, there's been pros and cons. Obviously, carers have been without support, and that's been very difficult. But some have found that home working has been really helpful, and they'd like to see that element continue anyway. Continue to provide carers allowance supplement at a higher rate, and that I believe is the intention of the Scottish Government. But we need to make sure that that continues. And exploring ways of providing payments to carers with an underlying entitlement, because only about 10% of carers receive carers allowance and have got the additional supplement. So just a few things in terms of the short-term measures. Longer term, you may have seen that the consultation has just opened this week, looking at the future of carers allowance or carers assistance as it should be known, and I'm sure you'll be getting more information out about that soon. We'll be doing a briefing paper with the national care organisations and make sure everybody on our mailing list gets it. Please feel free to put in your views on that. But in terms of longer term, certainly reforming carers allowance is a big thing. We think there needs to be a specific carer poverty strategy. Another one is the government has committed to ending care charges. We'd like to see that happen as soon as possible. And then the final one, and again, this will be covered in some of the discussion groups, is further support for carers in employment or carers seeking employment. Sustainable local carer services. I know there'll be quite a few carer centre staff on the line, and again, this is really important. Carer centres have been brilliant during the pandemic and have taken on lots of new roles. like access to PPE, like lots of grant funds that have gone their way that they've had to manage, extra respite funds, and most recently the winter funding. But they need support in terms of capacity. So I think direct funding for carer centres and young carer services in terms of looking at that additional role they've taken on and supporting their capacity. Ensuring that they're involved in developing national policy because they've got obviously expertise and are in contact with so many carers, they've got all that information. And making sure that any national funding is long-term and fully resourced. So basically what they're doing already, only supporting them more to do it, particularly with extra capacity. In terms then of longer term, I mean, like every sector, I think local care organisations are suffering sometimes from staff shortages and recruitment and retention. It's just part of the workforce as a whole. So looking at improved terms and conditions overall in social care. And investing in the digital capacity. There are pros and cons, like I say, about moving online. For example, today we've had larger numbers and people haven't had to travel. So making sure we've got an approach going forward where carers can still go to meetings face to face, but also online if that suits them better. And recognising the number of unpaid carers who also work in the care sector. So lots of care centre staff are carers already. So, you know, they also need support to combine their dual role. And the final two, and sorry, this is quite a quick run through, but I am hoping it'll set the stage both for our next session, speaking to Fiona and Michael, but then also the discussion groups as we move on. So carers as equal partners, this is always really important in terms of involving carers from the beginning to end, co-producing everything with them. So fully involving carers in plans for COVID recovery and service remobilisation. And not just carers who are sitting at the top level like Fiona and Michael, but also to make sure carers in their communities are involved in decision making as well. And the carer strategy, ensuring care representatives on strategic planning groups are fully recompensed, have full expenses. And we also think you should consider providing them with some form of remuneration. A lot of them, some of them are on the call today, it's a full-time job for them. And so we think they should get some form of remuneration for all the work they do. And finally, funding training to identify and support carers to become involved in local strategic planning. So it's not just one or two carers. So making sure there's in each area for the various planning groups, there are carers on them and those carers are supported. There will also be briefing papers on equalities and you know, some of the key things are just making sure that anything that is developed, any measures to support carers, make sure they meet equality duties and that any carers with protected characteristics are also considered and measures that are available also support them. And requiring local authorities to report on these actions to the Scottish Government, we would like to see that happen as well to make sure that, like I say, it benefits all carers from all communities. Now, I have not touched on young carers. There is a briefing paper for young carers and you know, we will be making them available as soon as we can. And Young Carers Alliance will be looking at all this as well. We don't cover young carers in our meetings. If it comes up in discussion groups, of course, that's great. But there is work going on alongside in terms of supporting young carers within the strategy. So just to say that. So that was just a very quick run through of some of the thoughts that we've had on this.